While drug overdose deaths in Maine have decreased in recent years, experts say rural communities still need better access to medication-assisted treatment and recovery options for people with opioid use disorder.
A new federal grant will allow University of New England graduate students now across the medical fields to receive hands-on experience helping people struggling with addiction. News Center Maine's Vivian Lee has more on our story from Porter.
Andrea Stem grew up in Gorham and always wanted to work in medicine. During her physician assistant training at the University of New England School of Public and Planetary Health, she hoped to help patients outside of the greater Portland area.
I was drawn to rural medicine because there's a huge difference to be made.
As a certified family medicine PA at Shakopee Valley Health Center, Stem does physical exams, prescribes medicine, and counsels patients. She works with doctors, nurses, and other staff. At UNE, she learned to recognize opioid disorders and address the stigma around addiction.
Any training in the academic setting can help reduce stigma and recognize signs and be able to initiate prompt referrals like to the medication-assisted treatment program here.
Greg Griffin is also a certified family medicine PA at the same health center. He grew up in Aroostook County and graduated from UNE. He believes this training should be the standard of care to help meet the need for opioid treatment, especially for patients in rural areas.
Almost every day we see patients who could benefit from an MAT program, so definitely having that knowledge base and being aware of what to do, where to send the referral, and kind of how to initially manage them and point them in the right direction.
Over the next 4 years, UNE will use a $1.6 million federal grant to expand workforce training for students from pharmacists to dentists and for providers already in the field to treat opioid use disorder and support recovery.
And we're tactfully trying to incentivize our students to go to those rural areas.
Devin Ann Sherwood, the associate professor in UNE School of Pharmacy, is the project's director. The initiative, called the Northern Border Rural Workforce, is designed to meet behavioral health care needs in rural Maine, where the opioid crisis is especially acute.
Just being able to come in and have that conversation comfortably. We are trying to look at treating substance use disorders more as like when you go in and get your vital signs with your primary care physician.
Now, UNE is collaborating with more than 24 rural hospitals and treatment centers, including those owned by Maine Health, Northern Light Health, and AMHC Community Behavioral Health Care Centers located in Aroostook, Washington, and Hancock counties. The two-track certification program will start in August of 2026. Financial assistance will be offered to students relocating to rural areas to help offset costs. Vivian Lee, News Center, Maine.
39 Maine municipalities are set now to receive millions of dollars in opioid settlement money over the next decade. Those communities could use that money to create positions for UNE graduates who become certified.